Night terrors. Night terrors, or sleep terrors as some people refer to them as, occur mostly in children's ages 3 to 12. A small percentage of adults are affected with this disorder. When night terrors occur, children experience sitting up, talking incoherently, walking around, and an enormous amount of anxiety. It takes a while for them to get out of this state of mind and to fall back asleep. The next morning, they recall little or nothing at all, except maybe the ideal of what they were dreaming about. Night terrors are known for their remarkable intensity and anxiety-induced feeling. Night terrors are not nightmares. Night terrors usually occur during the first few hours of stage 1 sleep, whereas nightmares occur during the last stage 4 of sleeping. In that last 3 or 4 hours of sleep, you are in a non-rapid eye movement, NREM, also known as delta sleep, and this can also happen when taking daytime naps as well. Night terrors occur less frequently than nightmares, but are far worse. Night terrors are estimated to occur 1 to 2 times in one night. Some evidence suggests that night terrors can result from going to bed with a fever and from a lack of sleep or poor sleeping habits. And in that case, it would also be helpful to have your child go to sleep earlier and wake up later. There isn't any consistent biochemical abnormality that has been identified to figure out the causes of sleep disorders. Some researchers claim that it might have something to do with your nervous system not being fully developed as a child, or being stressed out before you go to bed. Boys and girls of all night terror episodes are estimated at between 1 and 6% in children and less than 1% in adults. Night terrors begin at the ages of 3 to 12 and usually go away gradually when becoming an adult. In adults, the most common years are between 20 and 30 years old. Mental health professionals would treat some children with psychotherapy or counseling. In most children, though, night terrors eventually fade away and do not need to be treated. In extreme cases, benzodiazepine may be prescribed. There is also a schedule awakening theory that is said to work 9 out of 10 times to cure or prevent night terrors. You wake the child 15 to 30 minutes before the episode typically occurs, which would be in the delta state of sleep. According to the Diagnostic of Statistical Manual of Mental Disorders, 4th edition, which is the standard reference work used by mental health professionals to diagnose mental disorders, people with night terror disorder do not respond to attempts to awaken or comfort them.